Pertussis or whooping cough is a bacterial infection. The bacteria that causes this disease is known as Bordetella pertussis. This bacteria does have the ability to produce several toxins. One of those toxins is able to prevent phagocytosis. So the pertussis toxin actually is used as a leukocidin, and it can destroy phagocytic cells before phagocytic cells are able to engulf and destroy the bacteria. The pertussis toxin also has the ability to suppress antibody production, and as we know, when we have an infection, our body produces antibodies that can bind to the antigens on the bacteria and mark it for destruction. However, the pertussis toxin can suppress or decrease the amount of antibodies that are produced, allowing the bacteria to stay alive for a longer period of time. As far as transmission, it is transmitted through droplet contact, so obviously someone that has whooping cough is going to be coughing, and in those mucus droplets the bacteria can be found, and some other individual could inhale those droplets and acquire the disease that way. So as you become infected with Bordetella pertussis, you will advance through several stages of the infection, and the initial stage, which is the catarrhal stage, it lasts several weeks. The only thing you would be experiencing is a runny nose. The symptoms would be very nonspecific. Honestly, you probably wouldn't think that you would have pertussis at this point. You may think you just have like a sinus infection or just a common everyday cold. But during the catarrhal stage, you would kind of experience those nonspecific signs and symptoms and a runny nose. As the disease progresses, however, you will eventually enter the paroxysmal stage. During the paroxysmal stage, this is where you're going to experience all the signs and symptoms that are associated with this disease. So you will kind of experience that very violent coughing. So the reason why pertussis gets called whooping cough is because the patients do cough violently, and in between rounds of coughing they are short of breath, which causes them to have this kind of wheezing or whooping noise. But during the proximal stage, patients will be experiencing a violent cough. Fortunately, it is a disease that is very much preventable. When we're younger, we get a vaccine called DTaP, and DTaP is going to protect you against diphtheria, tetanus, and pertussis. That immunity tends to last, on average, about 20 years. Once that immunity wears off, you need to get boosters with a vaccine called Tdap. And then those boosters tend to provide immunity towards the same diseases for about 10 years. So it is something that you have to get continuously throughout your life. And unfortunately, a lot of people do not keep up on this vaccine within every 10 years. So we do see a lot of outbreaks of pertussis nowadays, especially amongst the elderly population whose immunity has worn off. And then here I do encourage you to watch this in the PowerPoint. It's just a short clip of what a whooping cough would actually sound like, so you can kind of hear that wheezing or whooping noise that is expelled during the proximal stage. The next disease is tuberculosis. Tuberculosis is a respiratory infection caused by a bacterium known as Mycobacterium tuberculosis. Globally, there are about 1.7 billion people infected with Mycobacterium tuberculosis. Does that mean that 1.7 billion people are running around actively sick and spreading tuberculosis? No. Fortunately, of that 1.7 billion, the majority will have a dormant form of tuberculosis known as primary TB. And when you have primary TB, you're not actively sick because the infection is dormant, and you will not be transmitting the bacteria that can cause the disease, so you're not contagious. Only about 5% of individuals that become infected with Mycobacterium tuberculosis will get active TB, where they do become actively sick and are able to transmit the disease to other individuals. However, those individuals that do get sick with active TB, it is quite a dangerous infection. So With TB, when you have active TB, it is transmitted through mucus droplets. So someone that has the active form, when they cough, sneeze, or speak, would expel the bacteria in their mucus droplets for others to come in contact with. There are different clinical forms of tuberculosis. Like I said, most individuals have the primary form, and in the primary form, you are not symptomatic and you are not contagious. However, what we worry about is that a primary form could eventually turn into a secondary form. And in secondary, you are actively sick, so you do have signs or symptoms, and you are contagious to others. This infection is typically, the secondary form is typically isolated to the lungs. So if the infection would spread outside of the lungs to other parts of the body, like the heart or the kidneys, at that point it becomes extrapulmonary TB. So extrapulmonary TB is TB that has spread to other organs of the body outside of the lungs. So we're going to talk about each individual form separately. So like I said, the most common form is primary TB, but keep in mind primary TB is the dormant form of the infection. So you are infected with Mycobacterium tuberculosis, but your body has to contain the infection, so it's dormant. You are not actively sick and you are not contagious. So how it works is when you first become infected with Mycobacterium tuberculosis, the bacteria get into the lungs, and macrophages in the lungs will phagocytose the bacteria. And we would think that'd be the end of it. We would think that those macrophages would release digestive enzymes, break down the bacteria, and then the infection would be gone. But unfortunately, Mycobacterium tuberculosis have a waxy cell wall that protects them from the enzymes released by macrophages. So these bacteria can actually survive inside of macrophages. So our body kind of feels defeated at that point, and it says, okay, I wasn't able to clear the infection by using macrophages. So the next job is basically just to contain it so that the infection doesn't continue to spread. So we're not trying to get rid of it. We're accepting that it's there, and we are going to contain it so it doesn't spread throughout the lungs. So to contain the infection, our body forms a granuloma. The specific type of granuloma that our body forms in response to a tuberculosis infection is called a tubercle. So a tubercle is basically just a pocket of tissue that forms around the infected macrophages to prevent the bacteria from getting out and spreading throughout the lungs. There are 3 different types of cells that come together to form the tubercle. Those are macrophages, fibroblasts, and then lymphocytes. So these 3 types of cells will basically come together and form a barrier around the infected macrophage, and that is going to prevent the bacteria from getting out and spreading throughout the rest of the lung tissue. Over time, neutrophils can arrive on site and release chemicals that can break down a portion of the tubercle. That can clear out some of the bacteria, and then that region of the tubercle, that tissue, is replaced with calcium deposits, and at that point that region becomes a necrotic caseous lesion. So that can kind of help lessen the chances that the bacteria could get out and progress throughout the lungs. But again, the whole purpose of forming this tubercle is to prevent the infection from spreading. It doesn't always necessarily get rid of the infection. So even if you have primary tuberculosis and it's dormant and it's being contained, you still need to get it treated, because what can happen is over time the tubercles can break down, and if the tubercles break down, they can become leaky, and the bacteria can get out and then progress throughout the lungs, and it can cause secondary or extrapulmonary TB at that point. And this happens quite often when people are immunocompromised. So if you have tuberculosis and you're in a dormant stage for years, and then all of a sudden you get cancer or diabetes or HIV and you become immunocompromised, well, what will happen is the tubercles will start to break down at that point. The bacteria will be released from the macrophage, and then the bacteria will continue to spread throughout the lungs, where you will get active TB. So it still does need to be treated to prevent active TB from happening. And here we have an image of a chest x-ray where we can see the tubercles on the chest x-ray as these little nodules. So Typically, if someone tests positive for tuberculosis in like a blood test, they'll do a chest x-ray to confirm by looking at those nodules. And then over here we have some macrophages that are actively infected with Mycobacterium tuberculosis. So what we're really trying to prevent with primary TB is we're trying to prevent secondary TB from happening. Secondary TB, think of it as active TB. So in secondary TB, you are actively sick. The bacteria is spreading throughout your lungs. You will have signs and symptoms, and you will be actively contagious. Now, secondary TB can happen one of two ways. Maybe you have primary TB, and your body does a good job of establishing dormancy for a period of time, but then ultimately you get immunocompromised, and then the tubercles break down and the bacteria come out and start to grow within the lungs, and then you get sick. That's one way that secondary TB can happen. But if you're already immunocompromised when you first get infected with Mycobacterium tuberculosis, you can completely bypass primary and go straight into secondary. Because if you're already immunocompromised, your body's probably not going to be able to form the tubercles to contain the infection, and the bacteria will just continue to spread, and again, you'll go straight into secondary with the signs and symptoms and being contagious. So in secondary TB, you do have an active infection. It is isolated to the lungs, so your signs and symptoms are going to be more respiratory in nature. So you likely will have a violent cough, and this cough will be productive, so you will be coughing up mucus, and that mucus will often contain blood or even like a greenish tint from the infection. You'll probably have a fever because you do have an active infection. TB patients do experience a large amount of weight loss. That's actually usually an indicator that you have TB, is if you've had a violent cough that contains blood for several months, and then you also have lost a large amount of weight in that period of time. That's usually an indication that TB should be expected. But then fatigue from the infection, night sweats, chest pain from the fluid in the lungs, that's all to be expected as well. If it's left untreated, it does have quite a high mortality rate. Typically, patients will pass from fluid accumulation in the lungs, which obviously cuts off oxygen supply. But still, 40% of people do survive. It's just essential that you seek treatment right away. Extrapulmonary tuberculosis is when the infection spreads outside of the lungs. So in secondary TB, the infection is isolated to the lungs, but the infection can spread. Mycobacterium tuberculosis can exit through blood vessels within the alveoli of the lungs and then get into the cardiovascular system. And then once they're in the cardiovascular system, they can essentially get anywhere in the body. I put a few examples, but really anywhere: lymph nodes, kidneys, bones, brain, heart. Like, they just travel throughout the body because once they're in the blood, it's a one-way ticket to anywhere. And then from that point, the signs and symptoms would vary depending on which organs are being affected. But extrapulmonary tuberculosis is just tuberculosis that has spread to other organs of the body outside of the lungs.